I'm Dr. Kees Rietmeijer. I'm a professor in the Colorado School of Public Health at the University of Colorado, and I'm the current president of the American Sexually Transmitted Diseases Association.
Greetings. I'm Hunter Handsfield, Professor Emeritus of the University of Washington in the Center for AIDS and STD. Until a few years ago, I directed the Public Health STD Control Program for Seattle-King County, and I'm a past president of the American STD Association. Who should be tested for herpes? Well, in many clinical settings, there are probably many people who are not being tested who should, and there are many others who are and probably shouldn't. For sure, people who need testing are those who have certain symptoms or other particularly high risk, who suspect they may have herpes or whose physicians suspect they do, and confirmation is needed. And the kind of testing that should be done, we can talk about, but blood tests and direct tests for the virus in sores and lesions have their roles. At the other end of the spectrum, there are people who should not be tested. People who are obviously at low risk and have not likely been exposed. The tests are simply not good enough to be reliable in people who are at very low risk for the disease.
Well, I can give you sort of my perspective on this from the clinic that I work in Denver, in our STD clinic, and what we typically do, and I think it's probably the practice that is happening in other places in the U.S. as well, is that we don't offer herpes testing to everybody in our STD clinic, for example. We do test folks that come in with genital lesions or other lesions that are indicative of something that could be herpes.
Clearly, people who have lesions at the time of presentation that are consistent with herpes, in whom a diagnosis has not been made, lesional testing, ideally by polymerase chain reaction or DNA testing, which is what is currently done in Seattle and is increasingly available, although we don't really have good data on how many labs are offering each kind. It is more sensitive than culture. It picks up more positives than culture does. And that's obviously the test of choice in that particular setting.